when your healthcare legislation was unveiled on Tuesday, some of the reaction was complaining about the fact that we weren't going to see the financing mechanisms for 2 years. And a lot of it was sort of along the lines of, how do we know really whether this is going to work until we know where's the money, how's this being paid for? What do you have to say to people like the Chamber of Commerce and others who are making that commitment?
Well, you know, I spoke to the Chamber yesterday, and, you know, I think they get it too. This is not about whether or not we're spending enough money on healthcare. This is about how we spend less money on healthcare. And let's be honest about this, what every healthcare reform effort in America, from the federal government to state governments, have gotten wrong, is they haven't figured out how to contain costs. We're spending money like a bunch of drunken bandits, and we're not getting the results that we should for those dollars. So we are on a pilgrimage to try to design the first cost containment system in the country that works. And that is the hard part. If we can succeed in designing a cost containment system that works, I'm convinced that we can convince Vermonters to pay less for health care than they're paying today. If we fail, another $1.6 billion by 2015 coming out of hard-working Vermonters' pockets. So we cannot fail. But I continue to say the challenge is to be the first who figures out how to deliver quality care to all Vermonters, so health care is a right and not a privilege, and do it at an affordable cost, which we're not doing now.
Why are you asking Vermonters to wait 2 years and then tell them in 2 years how much it's going to cost and how we're going to pay for it? Why can't you tell them now?
Because we don't have the answers. We don't have the answers. We don't even have the answers, frankly, of how to make a cost containment system work. No one has done it. So what our bill does is create the mechanism to do the heavy lifting and the hard work to come back with a system that contains costs. And they'll also figure out the financing. You know, we're on a fastest timeline that we can to a bill that will go in effect in 2014. And let's be honest about this, 2014 is a little while away. So we're moving as fast as we can. But our challenge is not, are we spending enough money on health care? Our challenge is, how can we deliver quality care, get the waste and the profits for those that don't need them out of the system, and make sure that our providers are making Vermonters healthier? And that's a really tall order. No one has done it. So give us the opportunity to design the system and figure out how much it's going to cost before we ask anyone to pay for it.
Some lawmakers feel that the bill that your team has introduced doesn't really give them an opportunity to weigh in on components of the plan as it's developed. They complain that a lot of the power is consolidated in the board, which would be handpicked by you. I don't even think lawmakers are allowed to make any choices there. So I wonder what you would say to that.
Well, you know, I'd ask them if they think the current models where we do really tough things work. Public Service Board, appointed by the governor with the consent of the Senate. Commissioners and secretaries, appointed by the governor, commissioner with the consent of the Senate. This is no different. So, you know, if they have better ideas, I'm all ears. All I can tell you is that board has to be really smart people who can get really tough things done that have never been done before. And I just don't think that a citizen legislature in 16 weeks, 12 more to go, can do that work. It's not a criticism of the legislature, it's just not their role.
Because it's not a judicial body. It's not like the Public Service Board, really.
Well,
it's not judicial.
It is. The vision is that it will have the kind of powers that the Public Service Board has over cost of health care that they have over cost of power. Frankly, the cost of health care are rising a lot faster than the cost of power. So I would say that their job's even more important.
Speaking of the Public Service Board, current chairman's term is up this month. Do you have any announcement to make, or will you soon?
No, I haven't worked on that yet, and I do know his appointment's up, and we'll be speaking with him, getting back to you as soon as we have any news.